Okay, hello everyone. We're going to go ahead and get started because it's 5 o'clock. So first of all, I just want to thank you for being here today and joining to listen to this webinar. Script Your Future is what we're doing this for, and we're doing a series of patient education webinars. This is the first in the series. There will be a couple more throughout the coming weeks. Script Your Future is a student-led campaign that focuses on improving patient adherence to medication and improving overall health outcomes in the community. And it's student-led, which is great. And I want to give a special shout out to Kavita and Jasmine for being so helpful in this process and making everything run really smoothly. So all credit to them for organizing this. So today I'm going to talk about tobacco use and cessation, which I'm really excited to talk about. As I'm sure a lot of you know, smoking cigarettes and using tobacco can be really harmful to your health, and it can be really beneficial to quit. And so today I just want to go over some different aspects of tobacco use and cessation, kind of an overview of what I'm going to talk about. So a little introduction, and then I am going to go into tobacco class. So when someone says they're smoking tobacco or using tobacco, what does that mean? And what are they referring to? What are the different types of tobacco that you can smoke, chew, all that. Epidemiology, so some statistics. Who is smoking tobacco in Ohio, in the United States, around the world? What is the prevalence of tobacco use? Some adverse health effects, and this is really the meat of this presentation, and this is really the most important part. You know, we know that smoking is bad for you, but why exactly is it bad for you? And I think it's helpful to really understand what happens when you smoke a cigarette or ingest tobacco, and understand what could happen to you if you continue to do it for the rest of your life, and then also what benefits might you see if you stop. And then I am going to talk about cessation tools and techniques at the very end, and I'll also touch on e-cigarettes and vapes, which are kind of a newer thing that we see nowadays, especially in younger populations, but I will touch on those because some people view them as cessation tools. So to kind of get started, just some objectives for what I want you guys and anyone who watches this to take from this presentation. So I want you to understand why using tobacco is detrimental to your overall health, which some people might just know that fact, but they might not understand exactly why. And so I hope that they have a broader understanding of why exactly tobacco and cigarettes are so harmful for you. And I also want people to understand more about e-cigarettes and vapes and how to evaluate their safety and efficacy in regard to cessation. And then also just to be informed on current cessation aids that are available to the public, both over-the-counter and prescription aids. Kind of get started, kind of a little tidbit about why I'm really excited to talk about this and why I chose to speak about tobacco use and cessation. In 2019, I was an intern at the WHO headquarters in Switzerland for about 4 months, and I actually worked in the health promotion and tobacco regulation department. And so a lot of what I focused on while I was there was tobacco laws and taxation and how to decrease tobacco use around the world to try to improve health outcomes. Some specific things I looked at were infant mortality in different countries that have different tobacco regulation laws, such as like public space smoking laws and taxation and whatnot. And then I also looked at adverse health effects of e-cigarettes and vapes. When I was there in 2019, it was kind of when we were seeing more and more teenagers hospitalized for vaping injuries. And so I did a little bit of research on that, and I'll touch on that later on. So to start out, what classifies as tobacco? When someone says, I'm smoking tobacco, I'm using tobacco, or I'm buying a tobacco product. So tobacco itself is simply a plant, and it's put into tobacco products like cigars, cigarettes, chewing tobacco, the things you see behind the gas station counter, those are tobacco products. And they all contain nicotine. And I'm sure most of you know, nicotine is highly addictive. And this is why smoking and using tobacco is so hard to quit, because nicotine is extremely addictive. Tobacco can be smoked, chewed, which includes dipping and sniffed, and like these pictures show, there's a lot of different forms of tobacco. And then e-cigarettes don't actually have to contain tobacco. Most do not contain tobacco, but essentially all e-cigarettes contain nicotine. And I think this leads to a lot of the perception that maybe they're safer or they're less harmful, but I'll touch on it later. But yeah, e-cigarettes do not contain tobacco typically. Some do, but most do not. So around the United States, how many people are using tobacco? So the CDC reported that in 2019, about 34 million Americans were smoking cigarettes. And so if you take people 18 years and older, that's about 14 out of 100 US adults. And then if you look at the image on the right, you can kind of see it's more prevalent among certain groups. So it's more prevalent in men, the ages 25 to 64, those who have lower education or below the poverty level, most prevalent in the Midwest where we are, and the South. And then just different groups: uninsured, disabled, those with mental illness or psychological distress, and certain cultural and ethnic groups. So out of all those people, right, we're getting 34 million Americans a year smoking cigarettes. And this has made it the leading cause of preventable disease in the United States. And as I'll touch on later, smoking leads to so many diseases. So it really is not that surprising that 480,000 people a year die because of causes associated with smoking. And if you take it into Ohio, it's about 20% of Ohio citizens that are 18 or older that are smoking cigarettes. And if you think about that, when you're driving around, walking around, like 1 in 5 people probably smoke cigarettes. And so this kind of makes sense. And then if you think about around the world who is smoking tobacco, the WHO reported that 1.3 billion people use tobacco worldwide, which is a crazy number. And actually even more interesting is that 80% of these people are from low to middle income countries and households. And there's a lot of reasons for this. One, I think is kind of easier to understand, is just the spending habits that come when someone is addicted to any substance. You know, you spend a lot of money on that substance, and it's harder to reach those higher income classes when you have the spending habits that come with addiction. So we really do see more tobacco use, mainly cigarettes, in low to middle income households. So what is actually in a cigarette that makes it harmful? I'm sure a lot of you have seen like this list before. I feel like we were told when we were younger, all the things in a cigarette. I remember nail polish remover was one they used to say to us. So here's kind of the list. Nicotine, like we talked about, it's addictive. Formaldehyde, which, yes, is the thing they use to keep dead bodies preserved so students can dissect them. That smells really bad. That's in there. Hydrogen cyanide, lead. If you hear of lead poisoning, that is a really big problem. Lead is in there, arsenic, ammonia, radioactive elements, benzene, carbon monoxide, which is what your house has a detector for to try to keep levels low because it can kill you. And then some other chemicals, nitrosamines, polycyclic aromatic hydrocarbons, and all of these have been linked to a ton of different types of cancers and other diseases. Okay, so what does tobacco do to your body? What is going on when you're smoking a cigarette? So the main compound we talk about with addiction is nicotine. And outside of addiction, nicotine actually acts as a stimulant for your body. And I don't know if you ever heard anyone use the phrase nicotine buzz, but this is kind of what they're talking about. So nicotine actually increases epinephrine, which is adrenaline. It's just like more commonly talked about as adrenaline. And, you know, if someone gets an adrenaline rush, you know that they're really amped up. And so it increases your heart rate, your blood pressure, and your breathing rate. And then it can also lead to sweating and diarrhea and nausea. So it just amplifies everything. But I mean, the reason people like it is because it's addictive. And the reason it's addictive is because of the dopamine pathway in your brain that it amplifies. So when you do something that's good and you get a good outcome, your brain gives you a little dopamine surge and it tells you to keep doing that because you got a good outcome and you enjoyed it. And so this pathway gets stimulated by nicotine. And so every time that nicotine enters your system and touches that pathway, it's telling you to just do it again and again and again because it liked it. So nicotine acts on that dopamine reward pathway in your brain, which is the cause of addiction. And things like cocaine and heroin, which I think most people can read those and think, oh, those are bad, like I don't want to do those. It's the same effect. They act on the same pathway in your brain in terms of why they're addictive. And then in terms of smoking, so lungs, I think, are what people mainly think of with smoking, mainly lung cancer. And that's entirely true because when you are inhaling something into your lungs, it just sits there. And if you think about it, the air that you breathe every day, very clean, hopefully, depending on where you live, and it should just go in and out of your lungs without leaving any residue behind. But when you bring in all these chemicals and toxins from smoking, then they just sit in your lungs and they make it really hard to breathe. So they can cause cancer, chronic bronchitis, emphysema, and all these diseases make it really, really hard for your respiratory system to just do the normal function of breathing. And you can get mucus and have trouble breathing because it's just thick and it's hard to breathe. And you're coughing it all up. You can get emphysema, which is just destruction of your lung tissue. And like the picture on the right that shows the smoker's lung, that is all black. That is essentially what happens to everyone's lungs after they smoke for a long time. It's been linked to over 20 types of cancer, which I don't think is surprising. Most people can at least associate smoking with cancer. And it increases your risk for heart disease, which can lead to stroke, heart attack, and death. And the way it kind of leads to heart disease is because it acts on your vessels. And so your heart, right, pumps blood to all the other parts of your body. And there's a lot of blood vessels in your heart and all of your body. And when you smoke, all those chemicals and toxins that you inhale, they go all over your body and they kind of sit in your blood vessels, and they make your blood vessels really small and really tight. And it's really hard to pump blood around your body. And that's true in your heart too. So your heart is supposed to pump blood out, and it can't do it as time goes on after you smoke because the vessels are too small. And that can lead to a lot of shortness of breath, a lot of chest pain. And also when you can't get blood to like the farther parts of your body, let's say your feet, then you'll get a lot of foot pain and ankle pain. And a lot of these effects of smoking are irreversible. So that's kind of what smoking and inhaling these substances does. And then secondhand smoke exposure is also very serious. So secondhand smoke itself, which I'm sure we've all been exposed to at some point, contains about 7,000 chemicals, and 70 of them have been known to cause cancer. In particular, infants and young children are really, really high risk for secondhand smoke exposure. And so if they, come home from the hospital to a house where mom or dad smokes, it can be really, really dangerous. They have a higher risk for developing asthma, a ton of upper respiratory infections, and even SIDS, which is sudden infant death syndrome, which is as scary as it sounds. So it's really important that when you have a young child that you keep them away from secondhand smoke. It's really important that if you're a parent, you shouldn't be smoking in the same house as your kids, around your kids. And smoking during pregnancy, there's been a ton of research that shows it causes really, really severe birth defects and even fetal death. And about 34,000 people a year die from premature heart disease due to secondhand smoke. And so when you're talking about quitting smoking, it really goes beyond just your own health and your own decisions. You can really affect those around you. Okay, so kind of talk about e-cigarettes and vaping a little bit, which I hope will be maybe some new information for some of you because they're kind of up and coming. And a lot of people use them for cessation because they contain nicotine, but not as many of the harmful chemicals. But, because they contain nicotine, they can help people's addiction cravings. And the picture on the top kind of shows different versions of e-cigarettes. The one that looks just like a cigarette is kind of what you see. And I don't know if that was marketed to try to let people feel like they're socially accepted in crowds that smoke cigarettes, but it's an e-cigarette. However, nowadays, I feel like we see the sleek and small like Juuls and other vapes that are kind of trendy nowadays. And these are increasingly popular among teenagers. And if you think about it, it really is a very similar trend to cigarettes. About like 30, 40 years ago when cigarettes became really popular and teenagers smoked cigarettes and it was really cool to smoke a cigarette. Now that's just been replaced with vapes. And you might think, oh, it's not as bad as smoking, but they can be really dangerous. And so vaping right now in the United States is the most commonly used form of nicotine. And the marketing style of vapes and that are used by the companies that produce vapes and e-cigarettes, and in particular Juul, is really targeted towards younger populations. And the way they do this is one, just by like where they advertise. They advertise on social media, they make their ads have younger people in them. They don't advertise them to quit smoking, they just advertise them to be cool. And they use different flavors. So you can buy different flavored pods and whatnot to put into your e-cigarette. And typically younger people are more interested in all the different flavors and whatnot. So the marketing style used by manufacturers is targeting young people. And the issue with all this is that there is lung injury associated. So when I was at the WHO, the research I collected was on EVALI, which is e-cigarette and vaping associated lung injury, which is kind of a newer term, and it's insanely broad because it had to start broad. No one really knew what the lung injury was. So you just had this big term that's just e-cigarette vaping associated lung injury. And outside of a lung injury, studies had already previously shown nicotine has dangerous effects on teenagers in particular. So more so than adults, teenagers who inhale nicotine are at a higher risk for addiction, mood disorders, ADHD, and substance abuse disorder. And the substance abuse disorder should make sense, and the addiction should make sense because nicotine is highly addictive and you shouldn't be exposed to it as a younger teenager, or else you're probably going to get addicted to something else later. So in terms of lung injury, when you think of a vape, they have those pods that are flavored, and it contains a little liquid, and the vape itself has a heating battery that heats up the liquid to a really, really high temperature so that the person can inhale it as a vapor. And if you think about it, like how hot do you have to get something to go from a liquid to a gas so you can inhale it? Pretty hot. And if you're inhaling something that hot, it's going to hurt your lungs. So that's the main cause of the lung injury. And another main cause of lung injury is when people take pods and they tamper with them on their own, and they maybe put different substances in there or whatnot. We see a lot of lung injury there. And a little tidbit that I think is super interesting, a ton of lung injury has been classified as lipid pneumonia, which is a really rare type of pneumonia, and it's called lipid pneumonia because of the histology. It shows a lot of lipids in the lung tissue. And the only other group of individuals that there are case reports about lipid pneumonia are performers who use the swords that are on fire and put them down their throat. So I don't know if you've ever seen this, like circuses or other performances, but there are people who take the swords and they're on fire, they throw them around, but then sometimes they put them down their throat. They get lipid pneumonia, and teenagers who use vapes can get lipid pneumonia. So that kind of demonstrates how dangerous this stuff can be. And as there's more and more cases of EVALI reported, there's more and more regulation. So now the FDA is starting to regulate the sales and advertising of e-cigarettes a lot more closely. So you have to be 18 and up in almost every state, and even a lot of states are going to 21 and up to buy these e-cigarettes. And so the big question people have is, well, can they be used to quit smoking? And I think a lot of people think that answer is yes off the bat, but they're actually not approved by the FDA to be a cessation aid. The main reason for that is because we don't know enough about the adverse health effects to say that they're a safe cessation tool. And most of the time, they actually contain more nicotine than cigarettes. So if you are smoking a pack a day of cigarettes and you're trying to quit, and you're thinking, okay, so I'll take 100 puffs of my vape a day to replace it. Well, they're more addictive. So you might end up taking 500 puffs of your vape and hurting your lungs just as much as the cigarettes. So there's really not enough known about them to say if they're safe. And based on the reports of EVALI, like in 2020, they reported 2,800 cases of lung injury and 68 deaths. And so I think that alone is going to make it really hard for them to get approved as an actual cessation aid. But there are tools you can use. So let's talk about cessation tools and techniques. So there's over the counter, and then there's prescription. So over the counter is accessible to most people who are 18 and older. And the focus of these nicotine replacement therapies is just what the name sounds like. It's giving you nicotine in a different way to possibly help with your cravings and the withdrawal symptoms as much as possible. And these come in a lot of different forms. I'm sure a lot of people have heard of them. The nicotine patch, which you just wear on your skin, and it gives you transdermal nicotine. The chewing gum, the lozenges, and all these things are really affordable over the counter. And they have been proven to work really, really well in terms of helping people quit, because the nicotine is the addictive portion. So if you can do nicotine replacement therapy, you can have a really good outcome with quitting smoking. And then in terms of prescription medications. So this is something that you would have to talk to your primary care physician about if you wanted to get any of these medications. So one of them is Chantix, which is varenicline tartrate. And if you guys are into pharmacology, it acts as a partial agonist. And so what that means is that when you take this drug, it gives you a little bit of what nicotine feels like. So it makes the withdrawal symptoms a little better, gives you a little bit mild nicotine effect. But if you added too much nicotine onto this drug, it would bottle you out. Like it would cause you to become stagnant in terms of the effect of nicotine. It won't let you reach the maximum effect. And so it's really effective at just keeping you at a lower level of nicotine so you can start to wean off. And then there's also Zyban, which is bupropion, and the mechanism of action as to why that helps quit smoking is not really well understood. It's an antidepressant, anti-anxiety med, but it works really well for smoking cessation. There's also nasal sprays and inhalers, which tend to be over the counter. And like I said before, just talk to your primary care physician if this is something you're interested in. That way you can understand side effects, what works best for you, what can fit into your lifestyle. And then also, as always, like counseling, motivational interviewing are really effective tools for smoking cessation. It can be really helpful to talk to someone about what barriers you're having to quitting, what is holding you back, all the benefits you could get from smoking, and how much those mean to you, and talking through it and even writing it out can be really helpful. And that doesn't have to be your primary care physician. It can be a licensed therapist. And it can also be these quit lines that exist. And so they're 24-hour phone services that you can always call to talk about smoking or quitting smoking. So if you are thinking about quitting and you just want to talk to someone about it, you can call. If you have quit and you're having cravings or you're having difficulty, you can call. So these are all really, really good tools to help quit smoking. So to kind of wrap up, in conclusion, smoking is really, really bad for your health. And if you quit smoking, your health outcomes can improve drastically. Even, taking 1 cigarette a week out of your current smoking routine, and then 2 cigarettes a week, and 3 over time, every cigarette really counts, and it can really help improve your health outcomes. Not all of those negative health outcomes are irreversible. Some of them are reversible when you quit. And so talking to your physician about the benefits that you can have from quitting and about different ways to quit is really, really important. And it's really important to understand it's never too late to quit smoking. It really isn't. Like I said, a lot of those health effects can be reversed if you quit smoking. And yeah, there's preferences. And I really want to give, like I said, a really special shout out to Kavita and Jasmine for organizing this, and to all of our faculty advisors who make this possible. There are some more presentations coming up. I can see the name of the presenters, and the Script Your Future Instagram has the dates for when those will be and whatnot. So yeah, thank you guys all for coming. Hopefully this didn't take up too much of your time.